October is Depression Awareness Month. It's a time to shine a light on one of the most common and often misunderstood mental health challenges affecting both adults and kids. Depression goes far beyond feeling sad. It can change how a person thinks, feels, and functions in their daily life. It affects how we are at school and at work, to our relationships and our sleep. Joining us now is Dr. Willow Jenkins, a pediatric psychiatrist at Rady Children's Hospital. Dr. Willow, thanks so much for joining us.
Thank you.
How common is depression?
Depression is really common. It affects about 1 in 5 adults worldwide, so it's one of the most common mental health conditions.
But when we say depression, what exactly does that mean, especially in children and teens, because it goes beyond just having a bad day or going through a rough patch?
Yeah, depression is really a sustained period. We look at least 2 weeks where you're really feeling down, sad, loss of interest in doing things, trouble sleeping, those type of things. And it really affects too many people, and that's why it's so important we have a month like this to raise awareness, because there's so much treatment and recovery really is possible.
So 2 weeks of sustained feeling down. What are some of the early warning signs parents and teachers should look out for?
Yeah, so for parents and teachers, it can be more subtle, looking for increased irritability, your child not sleeping well or sleeping too much, like big daytime sleep chunks can be a sign, not doing the things they like to do, dropping out of sports or hobbies, and then school performance changing as well, really can flag that you might need to get your child screened for depression.
Might they tell you? Would they be able to say, I don't feel good, I'm feeling upset? They may not.
Some may, but for a lot of teens, it's actually the irritability. And it's kind of funny because everyone thinks, oh, teens are irritable, that's how they are. But really when it's persistent, it's not just with you, you're noticing they're irritable at school, with friends, with things they normally enjoy. That's really a sign you've got to pay attention.
So how can people get screened for depression?
Yeah, so the best place to start is with your primary care doctor or pediatrician. But what I like to say is there's 2 real simple questions that anybody could think of today. One is, have you lost interest in doing things you used to enjoy? And have you been feeling sad, down, or hopeless? And if you answer yes to either of those 2 questions, you really should look at getting screened. And you know what, you can even do it online now. There's a really easy screening tool called PHQ-9. You can look that up, complete a screener, and take that into your primary care provider.
So what should someone do if they think they're depressed? Maybe take that online test?
Yeah, but the first thing is tell somebody. Okay. Don't isolate, whether that be a friend, a parent, or a healthcare professional. Say it out loud, because that's really the first step, and a lot of times the hardest step is admitting that you might need help.
What are the treatments? Just medicine?
It's a great question. For mild and moderate depression, we actually look at therapy as really being the mainstay of treatment. Cognitive behavioral therapy, a fancy name for a structured type. And then you can add in medications when it gets more moderate and severe. We love the combination of therapy and medication. And then not forgetting sleep, exercise, and really staying connected to people who matter to you. That really helps your brain.
I think that's important, staying connected to the people that matter to you, especially for kids. I guess for adults too, but I can see it really, especially for teenagers. So if a parent is watching right now and they are concerned about their child or their teen, but they don't even know where to start, what should be their first action?
Well, I think the easiest is book an appointment with your pediatrician. Pediatricians are trained in childhood depression. They know how to handle this. You could also access a counselor at your school. And of course, if you're ever worried about your child's safety, an emergency room, or call 988, our crisis line here in the US, 24 hours, confidential, trained counselors answer those phones.
And one more time, what's the link to the depression test?
Yeah, it's called the PHQ-9. If you put that in, something will pop up. It's easily accessible, or go see your doctor and they'll do it with you.
Okay, that's great. Dr. Willow Jenkins, thank you so much. We appreciate you.